Good morning, and welcome to the program this morning. It is a great day to be alive, and it's been a long time. It feels like if we haven't seen each other in quite a while. Well, it has been quite a while. The last time we saw was in July. We took a break. I needed a break. We all needed a break. A lot was happening, and so we took a little break, and we are back this morning with you. The thing is, though, we have so much happening. I have guests, but I'm going to show you the guests in a while. But I do want to just mention something that has happened during the time that we have been off. So this is the CCG hour, of course. And at the CCG, at the Conference of Churches in Grenada, we had elections in July, very late July. We didn't have a program since then, and we do have a new executive. So I just want to share that with you very quickly before I introduce the guests that I have for today. So at present, Archdeacon Michael Marshall from the Anglican community, he is our chair. And I am the vice chair. We had a very interesting elections, which we won't talk about here. Actually, we can. It was just a little bit humorous. So we voted, well, which is how we vote, because we do vote at the Conference of Churches. We voted the first time, we tied. We voted again, we tied. So we had to say, here what? It is obvious that God wants us to choose how we are going to work together. So we choose how we're going to work together. And I do believe that, I believe in seniority. Yes, Archdeacon Michael Marshall has been in the CCG much longer than I have been. And I am very, very happy to work along with him and to see the CCG into its next chapter. The secretary, Mrs. Valerie Rameau, remains. She has been our secretary, executive secretary for quite a while, and she's doing such a fantastic job. Well, we just unanimously voted her again. So she is there with us, and Mrs. Diana Pressy is, oh Lord, I hope I pronounced that right. We usually just call her Diana. So on air and for the record, I am apologizing in advance. I don't want to call her name because this pronounce the surname wrong. So Diana is our treasurer, and Reverend Stanford Simon is of the Grenada Baptist Association. He is our new communications officer, right? So that happened while we were off, and this is just to let you know. Archdeacon Michael and the whole team, we will be having a program just to talk about the CCG very soon. We are going to have a program just, talking. We are going to have an installation service sometime before the year is out. So I'm just kind of letting you all know that. So this is kind of like CCG news, yes? So that is what has been, as I say, has been happening. There are some other things that at the end of the program I'm going to just mention to you that I really do believe would be good for us to know about as it's happening in our community and will affect those of us who are in the Christian community, and I believe it will be worth sharing. So I'm going to do that towards the end of the program. So I turn to my guests. I have guests that are not very new this morning. They actually joined me last year, but now I have them in person. I'm so happy. Ravan, you look, I actually look taller than somebody. I know I'm not. But for some reason, the chair is doing me really well today. This chair is making me look very good. Thank you very much, Dwayne. You're making me look extra tall today. Anyhow, let me stop interfering and harassing my guests. Good morning.
Good morning. Good morning.
So I have Ravan and Stephen. They are part of the I have to get it right, and I have to put on my glasses to get it right. The physiotherapy. I don't want to say the physiotherapy people. That would not be nice. So let me say it properly, all right? Okay. Ravan, I have to look for it too much. Better you tell us.
So good morning. My name is Ruffin Charles, and to my right is Mr. Stephen Frank, and we are here representing the Grenada Physio chapter. And we are here to educate the public on how we as physios can benefit you. And there is something very important that if you keep listening, we will mention that's going to be happening on Monday.
All right.
So stay tuned for that.
Good. Well, the people who come on this program usually stay, which is a good thing. All right. So, Stephen, thank you very much for coming. And the last time, yes, I remember, you showed up. It wasn't for long. And you were very quiet while I get to talk this time. But it's good to have you. So, we're talking physiotherapy a little bit today. But particularly, there is World Physiotherapy Day coming up. Let's just talk about World Physiotherapy Day first, and then we'll talk a little bit about the theme and how we can, get on board. So, World Physiotherapy Day. Some people, I'm sure, not even aware that there was such a day. I mean, everything has a day these days. But anyhow, you have a day too. World So, tell us a little bit about World Physiotherapy Day, and and then let's go from there.
Okay, so World Physiotherapy Day actually started in 1996. That's approximately about 29 years ago. And it was the day that was selected was the day when our world body, which is World Physiotherapy, that governs physios all over the world, on the 8th. And that's when it was founded. So every year on the 8th of September, we're going to celebrate Physiotherapy Day. Right. And every year there is a different theme. And this last year's theme, which we talked about, was low back pain. And this year's theme is healthy aging, with an emphasis on fragility and fall prevention.
Nice. Okay. Interesting. And how many? I'm just asking this question. I don't know if you'll be able to if you have the number right there. But in terms of physiotherapists in Grenada, around how many do we have? I'm not talking about somebody who go in and look on YouTube and figure they got this certificate from there, and everybody listens to them because it works. My husband is one of those persons. He gave somebody something for their knee, and that guy is telling another person, hey, that man is a doctor. I said, Paul, stop repeating this thing. So, the real physiotherapists in Grenada, how many do we have?
Well, currently, I'm not sure of that exact figure, but I would say it's a handful.
It's a handful still?
Yeah, still a handful.
Right.
So I definitely would encourage the younger population, the students, to definitely study this field, because it's a growing field and it's a heavy caseload for me and Mr. Frank. So definitely there are people that definitely needs this service. So if you're a student, definitely consider physiotherapy as a profession,
right,
or as a career that you can do.
And why I ask is not just, I could be very humorous, and not so much that you may have had this statistic, but the fact that you have a chapter, I'm just thinking that maybe, you would have had, those who are physiotherapists would be, of course, a part of the chapter, So in the chapter is how many of you?
Well, currently within the chapter, how we formed the chapter this year currently was in relation to get the World Physiotherapy celebration started.
Right.
So we have persons that are physios, some persons that are PTAs, some persons...
What is a PTA?
Physiotherapy assistant.
Okay, because you see, we know what is a PTA in Grenada.
Oh,
that's
okay.
a parent teacher.
Oh.
Okay, let me stop teasing. Go ahead. Right, so physiotherapist assistant.
And also we have well-wishers. So what is our goal or dream? That we would form a physiotherapy association. So we are actually meanwhile working on a constitution to do that, as well as getting the statistics, because everyone who is a physio or physiotherapy assistant, as well as within the allied health, is registered with the allied health body of Grenada, allied health professions. So we're going to get that statistics from them so we can know exactly how many physios there are there, and we can educate the public better. All right. So they can have a informed decision.
So it wasn't too much of a bad question that I asked.
No.
No, and I'm glad that you are mentioning and encouraging that those who are going off to study, well, whether it's in the field of medicine, even if they didn't have it in mind, but definitely to have that as, part of the career options. And so I'm saying to you, especially being in the education sector, that is not just wait for the career day. And without a doubt, I'll be calling on you for our next career day. Yeah, because I know for sure we didn't have a physiotherapist earlier this year. But definitely, if we can get persons like you in the schools and letting people know? Because as I said, to be honest, how many times do we actually sit down? Everybody here doctor, we hear dentist, and other, things to do with medicine, but we kind of don't think of the physio, except you have a need for him. Yeah. And whereas you hear about the doctor whether or not you have a need for him. So we really want to make it become just part of our, really a part of the community. So you said the work is hard. Do we have any options for studying here? So like, is it done at SG, or our persons must go out of Grenada?
Currently, SU doesn't offer a physiotherapy program. So if you have to study it, you would have to go overseas. In the Caribbean, the option you have is the University of the West Indies.
Okay.
They have a bachelor's degree in physiotherapy, as well as the University of Guyana also has a bachelor's degree in physiotherapy.
Okay.
And that's within the Caribbean.
Yeah.
Now you can also go to the UK. Cuba as well. Cuba is also part of the Caribbean. So you can also go to Cuba, get a scholarship, go to Cuba. You can go to China, as what me and Mr. Frank did.
Oh, okay.
Yeah.
Right.
And America or the Western was, because the Western was their workforce was. So you can definitely get a physiotherapy program there.
Okay, all right, cool. But of course, with programs like these, we are going to, encourage individuals. So I'm sure that you're going to share your numbers after, so that persons may be able to get some kind of counsel when it comes to that. Because I agree with you, that there definitely is a need for it. So I am also wondering, is it that, seeing that we know for sure that among the number of physiotherapists, obviously a few. We can't say as yet, from a very informed place, it's only 2 of you, but we know it's very little. So is it that you work with the government? When I say with the government, like in clinics and so forth, or is it that you do only private work?
Right, so I work at the General Hospital, the physiotherapy department.
Okay.
Right? Yes, and at the General Hospital, we see both outpatient as well as the persons on the ward for physiotherapy services and so on. As it relates to that, for persons like who are interested to have a physiotherapy at the General Hospital, it's a free at General Hospital, right? However, persons would come in via a referral from a doctor. So it could be via the hospital referral, or you can come in from a private doctor. They can give a referral to come to the physiotherapy department. You just call, you make an appointment, and the secretary is going to call it. You know when you can come in to have your session started.
But that's the only challenge. Because it's so few of you, I can almost imagine the wait, or shouldn't I even bother to imagine the wait time?
Yes, so there is a waiting list due to the amount of persons and so on, and as you say, the limited amount of physiotherapists you have in Grenada.
Right.
Yeah, there's a wait list and so on. However, we try to work with persons and so on. Sometimes you show up to get an appointment and so on, but things that we can advise you on, little things that you can do in the meantime as you wait on the appointment to come.
Excellent. So hence we have programs like these. Well, let me stop talking. Let's talk a whole lot more about the theme, and of course giving persons counsel as to how we can really, engage in healthy aging, which is everybody. I think from the time you're born, you're aging. So let's talk about that.
Okay, so as you said, healthy aging more or less is the ability to do the things that you like to do as you age.
Right.
So that can go throughout your entire course of life. So as a person in adolescence, young teenagers, if you are not able to do the things that you like to do, for example, if you like to play sports and for some reason you got an injury and you cannot partake in sports, right? That affects your activity level. Yeah. So that in that aspect is not aging healthy. And as you go on to persons within midlife, right? You're a construction worker, right? You get that back pain. That back pain is very severe. It affects you from going to your job. It affects you from going to hang out with your friends. Or you're an elderly person, right? You have that arthritis. It affects you from walking up your stairs. It affects you from enjoying your house. It affects you from going to the beach, going to the church. So these are the things that, if you have those effects in your affect your participation in life social activity as well as your activity levels or doing the tasks that your day to day, such as washing, cooking, cleaning, if that's become difficulty, then you're not aging healthily.
Really? Hold on. Stephen saying like he anticipated the question I'm asking next. So, even if you're doing what you're doing with a whole lot of pain, because I have a feeling that is what we tend to do, pain and a White Cross therapeutic rub. From the time we start to rub, and I really, and you could use my elbow today as your manicure. I don't mind, eh? So I'll give you my elbow anytime you want to show anything for the camera's sake. But anyway, if it is that you are having a challenge, as I say, pain, mostly the pain, and you're forcing to do it, but you're taking medication, the White Cross, every other thing that we rub with, even during that time that you're functioning, you're not aging healthily.
No, because what would end up happening is that even though you're medicating the pain, the tissues and the structures are there that are wrong there, like the soft tissues, muscles, and so forth. Over time, as we age, they progressively get weaker and weaker. So yes, you're taking the pain medications and you're doing activity, but you soon realize your scope of doing that will become decreased less and less. So for example, you have a cupboard, right? And it's easy for you to reach up to get to the cupboard to grab a cup. But you have shoulder pain and you have been nagging for a long period of time. And one day you notice that we could have reached here, but now you only can reach here. A month passed, now you only can reach here. And then you just realize that you're not able to completely lift off your shoulder. All because that structural issue that you had within the shoulder, you wasn't taking care of it. And the muscles, the tendons, the ligaments are wrong there. Progressively over time, the tissues get weaker and weaker. The capacity to do the job get weaker and weaker.
How are we fixing that?
So how we fix that, great question, is through physiotherapy. So we, as physios, we would create a structured plan. So we'll look at, let's say, for example, if it's the same shoulder, we'll look at the range of motion to see if there is an issue there. So we can create an exercise plan to help increase range of motion. If it's a strength issue that you're having within the shoulder, we can create an exercise program to help strengthen those structures so that you'll be able to meet the demands of the environment. Yeah? So if you
want a grenade to come by all you. But I'm serious, no. I know it's so humorous, but because I've had a pain here. So I come to the physiotherapist. No, but seriously, I have had this pain. Apparently, they told me that when I was a little child, you'll notice that this is clearly not straight, right? That when I was a baby, I got some surgery done, right? But I remember in growing up, you know, I used to say, but my hand, it wasn't this pronounced, but you can definitely see that there is. Now, so I do a lot of things with my hands. I bake, I do cakes, a lot of things. I'm a very active person. But I do what I do, but I will feel that, oh boy, you know when you're finished doing it. I think that's the only way to, when you're finished, I know I did a lot. Yeah. But now it's more than just when you finish doing. I tend to feel it now even more so. And when I touch here, you literally feel that something is happening. So whether it is that I knocked it, besides the surgery part, I don't know if something happened, like how I'm sure many people who are looking might say, well, I don't know what I did. So in a case like this, noticing that this clearly has been there, I should have come to this physiotherapist since a long time ago.
Definitely, to get it sorted.
Lord have mercy.
Because you know, in Grenada, we have this tendency to
but
wait
I tell you, I use a lot of White Cross.
You know?
White Cross therapeutic rub, saffron, and many other things. I did a lot of rubbing. Oh boy. Don't laugh. Look, I find you look like you're laughing at me. But seriously, okay. So this really should have been checked out.
Yes.
Wow. Oh my. Okay, so you know what? Tell us the some of the conditions. I deliberately use this because, I mean, it really is affecting me. So we'll have a serious conversation after. But what are some conditions? Or maybe I should say, at which point, really, should persons be reaching out to the physio?
I would say that, before I answer the question, Grenadians, we have this tendency to wait until we use this for quote-unquote water, mood, and flaws.
Yes, we do.
So we like to, quote-unquote, grind the pain. We like to grind until, now why? We try to play Superman, we try to be Superwoman, you know? And even though we have the pain, we still do what we have to do.
Oh, yes.
Yeah. And then until we come to a point, nah, boy, what? Can't make it. And then, you know, we like to wait too late. So I would say, you know, early intervention is key. So once you notice something or you're aware of a pain or a niggle within your shoulder, you're feeling stiffness, then definitely try to go get it sorted out. Because the earlier you go, the better. And the better prognosis or the better outcome you can have later on.
Right. And that will be for
any condition. If you feel, because it's better that if you know that you feel that you have something, it'd be a knee pain, or, you know, I used to play football, or you're a person who used to play football when you're younger, you know, in your maybe 30s, 40s, and you're having that ankle pain, you know, and you find it stiff sometimes, you know, then definitely try to go get it sorted out, get it checked by a physio so they can more or less improve that mobility, strengthen the structures around there, so that your ankle can meet the demands of the environment or meet the demands of your job. So, for example, if you are a construction worker and, you know, you have some hip pain, right? You do a lot of heavy lifting. So you definitely would need to get that hip sorted out, whether it be improve the mobility as well as strengthening muscles around the hip, so that when you go back to do those heavy lifting, the muscles that are there, they can meet that the needs of that environment. So you'll be able to lift efficiently and safely.
Safely is a challenge in Grenada. Safely. You see that word safely? Anything with safe in front. I think we have an adverse reaction, I find, in Grenada to safety. Generally. And I know it's not everybody, but I find that we do a lot of interesting things. And I put in that interesting, quote unquote. When it comes to health and safety, I don't find that we practice it too often at all. So falls, because if it is that you fell or you knock the elbow, come to the physiotherapist right away, or do you wait like at least maybe a week, or you know what I mean? At which I hear you, I understand you mean come to you, come to any physiotherapist, but usually we tend to go to the general practitioner. And they, according to what is happening, I mean, I know for sure I've never been referred. Okay, well, in all honesty, I don't think I ever went to the elbow. Because you're telling them about every other thing except that, because you figure you could grind that and handle it for yourself. It's not a big thing. So, right. But if it is that you did mention that to a GP, Lord have mercy, I say a GP, would it be that even if they did not refer, or they gave, you know, maybe just some medication for pain or so, what happens then? Because I really want people to be advised well and know when to really come by y'all.
Okay.
Yeah.
So, well, currently, in terms of the process and so on, most referrals usually comes from the general practitioner or an orthopedic specialist and so on. They would refer to physiotherapy as it stands currently and so on. However, persons and so on may choose to come directly to the physiotherapy if you realize you're having a functional issue, because we specialize in function, because in movement. So if you're having a functional issue, a movement issue and so on, and you need a second opinion, say you went to the doctor and so on, and maybe they haven't referred you to the physio and so on.
Right.
Maybe you can take a second opinion, you can visit the physio that relates to functional issues and so on.
Yeah. So once you can't do.
Yeah.
Okay. All right. Monday, please God. Yeah, let's talk about money, because I know even you all are excited about it.
Of course.
Yeah.
Of course. I'm very excited about Monday. But before I mention Monday, for the World Physiotherapy Day, the Grenada Physio chapter, we organize some activities.
Right.
So for this, we had a social media drive. So we have a Facebook page and an Instagram page named the Grenada Physio Chapter.
Right.
So there's information there to the general public to learn about what physiotherapy is, how our role and how we can benefit you.
Right.
In nice, infographics, very eye-catching, for the younger generations, and very simple information so that you can digest.
Right.
Also in relation to that, we went to some homes. So we went to the Hilarion home, went to the Cadrona home, as well as the St. Martin home.
Right.
To educate them on what healthy aging is, as well as, so we did an exercise session with the elderlies, as well as giving the staffs tips and so forth.
Nice.
If you deal with someone who has high disability or fragility, how to help improve their mobility, basic stuff for the persons on the bed, so that they can provide that care to them.
Wait, hold on. So you plan to tell us that now? Because there are lots of persons who have persons at home with very limited mobility. And I believe that sometimes they don't want to say it. Sometimes we don't say that you're frustrated, that this is really becoming difficult, that it is, boy, I love Granny, but boy, that pressure. They wouldn't say it. A lot of people don't say it, but really and truly don't know how. So are we going to touch that after we talk about Monday?
Okay, sure.
Okay. Excellent. Monday, go ahead.
All right. So Monday is the big day.
Yes.
September is the big day. We will be at the Esplanade Mall courtyard, and this is with collaboration with the Ministry of Health. So we're going to have a nice tent there, a nice booth. We're going to have infographs. We're going to have more physios, not only me and Mr. Frank. We're going to have a lot of physios there, right? And we're going to give some information to the general public. So if you want to learn about healthy aging, definitely come out. Or if you have any pain, niggle, whether it be neck pain, shoulder pain, elbow pain, wrist pain, back pain, hip pain, knee pain, come out, get some advice. As well as if you know a friend or your family member had a stroke or suffering with anything and you want any advice, come out and get that advice. It's free to the general public, so definitely utilize it.
And the time?
And the time would be we'll be there from 9 a.m. to 3 p.m.
Whole day?
Yeah, whole day.
Okay. What do you think the kind of wait time might be for persons to get? I mean, yes, you could easily grab a brochure or something, which I'm sure you're going to have. But in terms of being able to sit and, talk with someone, get advice, I know you say you have a good bit of physio, clearly not the two of you alone, but still, like, somebody's on their lunch hour. Do you think somebody who just get that 1 hour alone will be able to get that kind of one-on-one?
Of course, because definitely be able to.
Okay.
Because we're gonna have enough persons there, and we could prioritize, to ensure that it meets the general public. Because we are there just to provide education and to help you, so that you can make an informed decision about your life and your health.
Right. I like that. Okay. The elderly that you were talking about, if they come, because we encouraging everybody to come, and I'm thinking, I don't know if that is a correct thing. I doubt it is, but we kind of think that we have more pain when we getting old. Is that the truth?
Not necessarily the truth, but when you do age, you do have physiological changes in the body. So it is a true thing that when you age, your muscles will get weaker, your bones will get weaker. Right. So, and due to that, there's an increased tendency to have injuries or conditions with that. So it's a tendency to say that, yes, you may have more pain. However, as we stated before in our team, if you are aging healthily, if you are maintaining your strength, then more than likely you will not have suffered with that.
So you see, you have some really sprightly elder people. They're looking good. They those of us who, I know for sure I can't run with some of them at all. And maybe, I don't know, they have not seen the physiotherapist at all, maybe in their whole lifetime. What would you say as it relates to exercise that might be contributing to that, for want of a better term, that sprightliness that we see? Is it really exercise? I mean, I know we can't just answer that on behalf of everyone, because it could be a myriad of factors. But still, what part does exercise really have to play inside of physiotherapy and healthy aging?
Right. So exercise is one of the key components when it comes to healthy aging, and it don't matter how much you do. It's what you encourage person to be active, to be moving, and so on. Right. Approximately, they say 2 to 3 days out of the week or so on of within 30 to 45 minutes of moderate to intense aerobic exercises and so on. Or it can be from 72 hours to 150 hours of strength exercises, more or less resistance training you want to do. And that itself, it helps to keep the body, strong. It keeps the aerobic system going as well, to the aerobic exercise and so on. And keep the bone healthy. Even makes you look younger as well too. You keep the skin looking much more flourish and so on. And so exercise and as well as diet as well too, because it comes hand in hand. Exercise and diet is quite key and so on. Yeah. And you do regular checks and so on. You visit doctors and so on to make sure all the systems are functioning. And as you'd say, those persons are very spritey out there. I believe they have an understanding of their bodies as well too, and how to maintain the level of physical activity and to be active as well as to be jubilant. I would say as well, because one of the key things as well when we speak about healthy aging, we speak about maintaining relationships, maintain a healthy lifestyle, and doing the things that you love to do.
Right.
To continue doing things that you love to do.
So not just the physical.
Yeah, just physical. Yeah. So it's important to do the things that you love doing, the fun stuff and so on. If you like to go to the beach and so on, as you age and so on, you shouldn't stop going to the beach. It should be an encouragement for you. Okay, you look forward to going to the beach and so on to get some sunlight, to swim in the water and so on. Yeah.
Okay.
And then maintain relationships and so on. We are social beings, so having a friend to speak to and so on, it does a lot to keep you and keep you young.
Okay, we'll take a quick break. When we come back, though, I'm hoping that you'll be able to show us some basic exercises. I know we're not diagnosing. We are not diagnosing. This is not for every pain that you have to say. You're not coming Monday and you're not going to call. But we do want to just show, 1 or 2 just basic exercise, especially in terms of the how to, for back, for lower back, and for the elbow. I mean, no, I will still come by you. But, no, I'm just looking at, because I know sometimes, because we use our hands so much, I'm just thinking that we can possibly show that, like how we should place our bodies, that kind of thing. So we'll take a quick break. We are going to be right back. Stay with us. Check whatever you have to check real quick and come back. We are going to be back with you maybe in just about 30 seconds to a minute. Yeah, so we'll be back. Goodbye.
Reaches to me in the fullness of your grace, in the power of your name. You lift me up, you lift me up. Let's sing. Unveiling love, stronger than mountains,
right, where we standing now. Okay, so I did say just before we took the break that we are going to just show a few exercises, but we're doing those that we have to stand for. So I'm handing over to these gentlemen. We are going to look at shoulder and elbow.
You could just shoulder and elbow.
It look like I'll get help about my elbow. So I'm going to hand over to them. Let me just step to the side a little bit and do what you all do. Go ahead.
Okay, so again, good morning, Grenada. One of the things that you see, especially when it comes to the shoulder joint, right? A lot of persons will suffer with what we call a rotator cuff injury. Or some persons may hear the word shoulder impingement or shoulder bursitis or rotator cuff tendinopathy. All of those things are the same, all right? And what we, from a functional perspective, because it's a tendon issue, right? It's in our realm, we call it a muscle power deficit, right? So first thing we would do if we are going to assess to see someone has rotator cuff injury, what we're going to assess the person's strength, right? So before that, normally we just go to some normal range of motion. A normal thing that you would see with persons with that, they would have a painful arc. So asking them from here to just lift your hand up, lift your hand up, right? And bring it right up to here. Normally the painful arc is around 60 degrees. So if you're getting pain from any range from here to 120 degrees around here, then, and the pain, as you come all the way to the end range, you have no pain, that's an indication of a painful arc. So that's one thing that's saying that we look for if someone has a rotator cuff injury. Another thing we will do, we're going to do some muscle testing. And the rotator cuff is a stabilizer muscle, and what it more or less does, it helps with external rotation. So we're going to assess his shoulder external rotation. So from here, I'm going to ask him to bring his hand out here, and we're going to apply a resistance to it, right? And if in that case you do this here and you get any pain or production of his symptoms as well as weakness, that's an indication that he may have rotator cuff. Another test, we bring the hand shoulder out here at 90 degrees, right? And then I'm gonna ask him to bring it out here, and then I'm gonna push down. I ask him to resist me. Resist me, right? And if there's any pain here, right? Another indication. And weakness, indication.
Wow.
Now, another test we do, we call it the empty can test, and the indication goes with the thumbs pointing down. So I'm going to ask him to bring his hand out, right? Point his thumb down, right? And that's a specific test for a specific muscle we call the supraspinatus muscle, right? Supraspinatus muscle, which is located right here. Another type of the rotator cuff muscle. So I'm going to ask him to bring it here. I'm going to apply resistance, right? Resist me. Go on, resist me. Give me some strength. Good. And if there was any pain or weakness there, indication that he probably has a rotator cuff.
I have a feeling a whole lot. From the time you do the first one, I'm already hearing a lot of ouch and oh God. Okay, all right. And so from the time, even when we begin to feel these little, because we do feel them, we shouldn't be just rubbing and icing and rubbing more. Because and then going at which point though, because sometimes we just, and I mean I've said it maybe, and I'm sure I may have said it in error sometime, where I would say to somebody, oh, I think you just need a massage. You need to relax yourself and do some me time. You're feeling, is it that we should just be going for massages, especially when we have been feeling discomfort in joints and so forth? Should that be our best first choice?
I wouldn't say it should be your first choice. Right? No, if you are someone and you had a very busy day and it's your birthday, you want to relax.
Yeah.
Definitely go for a massage, right? But if you are suffering with a functional thing that affects you to do your day-to-day activities, for example, you are a carpenter or you are a painter, and it's difficult for you to lift your shoulder because it's painful and you cannot really get up there to paint. I wouldn't recommend you to go to a massage. I would recommend you to go to a physio to get that assessed and to find out exactly what is the reason that you're having issues or pain or weakness lifting your shoulder up overhead.
Got you. All right, elbow.
Okay, so normally when it comes to assessing the elbow here, because what you have on the indication of what you have there, it seems to me that it more or less is tennis elbow, That's what
What?
tennis elbow. We call it tennis elbow, or we call it lateral epicondylitis.
Jesus.
Or
Thank God for
or the
tennis
other
elbow,
name,
that
or
other
the
name.
other name is lateral elbow tendinopathy.
Jeez.
Right? All of these means the same thing for us, but it's just different terminology to explain the same thing.
Right.
So if someone is suffering with that issue, it's something you see normally in sports. That's why they call it a tennis elbow. However, persons who utilize a lot of their hands on the wrists, maybe a lot of typing, or maybe kneading, or bakers that use their hands a lot, probably, or even mechanics as well, or persons who use a lot of screwdrivers, turning, may also suffer indication with persons who have lateral elbow tendinopathy. So for us, if someone has that condition, what we would do to assess it, since that it is again, a muscle power deficit, that's what we would call it from a functional perspective. We're going to do some strength testing, right? So how we're going to assess this muscle here is more or less is the wrist extensors that more or less connect to this bone here, which is the lateral epicondyli of the wrist, the ulna, right here. So we're looking to assess this, right? So normally it's good to do it sitting for this one, but we're going to do it standing. So what I'm going to ask him is to bring his wrist back or extend his wrist, and then I'm going to resist it, right? Resist, and if there is any pain right here or weakness, then that's an indication that he has.
Well, sure. That is what I have.
Another one is we assess the middle finger individually, right? So you're going to bring on the middle finger, we're going to apply a force, and if pain comes here again, that's an indication of that he has lateral elbow tendinitis. Another thing with that too, as well as persons now would have some stiffness, so we're going to assess the range of motion. So I'm going to ask him to more or less bring his wrist inwards like this for me, all right? And then I'm going to extend his wrist and bring it out and assessing to see if there's any pain or stiffness here, because I'm stretching the muscle. If there's any pain or stiffness here, that's an indication, more or less, that he has lateral elbow tendinopathy.
I'm not even going to try it. You? Okay, so and these simple, because these are the tests, even if someone may have looked at us just here, and maybe shared in, because what we are curious, most likely we would have, somebody I'm sure out there would have done what you just did to test and see, I wonder if I have what they're talking about, But in a case like that, even if you did feel the pain and whatnot, and maybe the person chose not to come to the physiotherapist immediately, in terms of basic exercises, and I said, this is not us diagnosing your problem. You have to come for that to happen for yourself, right? But I'm just saying, in terms of, okay, so you know what? I make up my mind. I'll come by the physiotherapist, but I still have this to do over the weekend. What can I do to stretch? Do I just go stretching? You understand what I mean? When in terms of even getting a little bit of, getting some kind of assistance, what is your best alignment, that kind of thing? I just want some kind of basic, Okay,
so basic exercise, you're going to do shoulder.
Yeah.
So first off, what we would do when someone has rotator cuff and it's a bit inflamed or triggered, we're going to tell them to do some just basic range of motion exercises. And this can be done on the chair, so you can have a seat on the chair. Yeah, you should be able to see.
Yeah.
And pull it. Yeah, we're going to use the chair on the
just
table.
Just put it in, yeah.
Then we're going to ask the person here to go through some basic shoulder range of motion. So first from here, ask him to stretch his hands out. So he's going to slide, so here, and he's sliding forward. And that sliding forward motion would bring his hand into flexion.
Really?
Right? And then another way is from the side view, come to the side. And the hand here, and he's sliding forward, right? And come back. Sliding forward, and come back. Putting his hand in this motion that we was here, but it's more or less from this direction.
Right.
Right? And yes, and those are more or less some of the two more or less basic exercises that you can start with. So for persons who have that, if it's inflamed, stick to trying to get some normal shoulder flexion and some shoulder abduction. And that's what you can do from the start.
Yeah.
And to get more information in terms of going about, then definitely seek a physio so that he can give you that individualized plan to take you from step A to B to C to D and to back to returning to work.
Yeah. Okay, excellent. Stephen, anything else you need to add? Because you know an hour flies by here. It goes by faster than any other hour. Yeah, anything
Yes,
else?
I just want to encourage persons to stay active. Niggles, injuries, and so on. They say pain is a sign of something is wrong in the body.
Correct.
Right? So when you have those pains and so on, now just you can reach out to a doctor first if you want to go that route, or once it's a functional issue, then you can go directly to the physiotherapist and so on. Yeah. So stay active. Maintain good mental health as well too. I think it's a key area as well too, as well as nutrition. Yeah, and once you're active and you're eating well, you're sleeping well, you speak to persons and so on, certainly believe that you can be that sprightly person.
Yeah, I think that. All right. Just share your contact information as it relates to if anyone wants additional information concerning Monday God's Will. But of course, just repeat so the association. Yes, man, I'm going to prophesy. The association.
Yes, definitely.
So, World Physiotherapy Day will be celebrated, particularly that's next Monday coming at the Esplanade Mall, and just come on out and get a whole lot more information. Telephone numbers, and then we close up.
Okay, so my telephone number, I'm Ruffin Charles. My telephone number is 420-3848. That's 420-3848. And if you need any assistance, please feel free to reach out and get that information so that you can have a better quality of life.
All right.
Okay, so it's Stephen Frank, and you can contact me at 458-0583, or you can call the General Hospital Physiotherapy Department as well too, and you can also speak to other physios that are at the General Hospital as well.
All right, thank you so much, gentlemen. It has been a pleasure. I like that we are not sitting down for the whole hour, but I'm very sure that we are going to, continue to talk, because not just when World Physiotherapy Day is coming up, you are welcome to come and really share, because I really do believe that that we need it. Yes, you could go on YouTube, but I do believe that we need to be directed. Sometimes we could just go grabbing things all over, and we're not very sure of what exactly we really need, and not know what is the good and what we should throw away. So thank you so much again for coming, and I pray that you all are going to have a really, really successful day on Monday, God's will. Most likely, I'm going to try to pop over. I think that will be good. And thank you. Have a great weekend. Those of you who have joined us until now, thank you very much for staying with us, and have yourself a really great rest of your day and a wonderful weekend. See you Monday, God's will. Bye-bye.